conversation. So I'm thrilled to invite Sarada ma'am. Sarada Muraleedharan IAS recently retired as the Chief Secretary of Kerala. She headed the Kudumbashree mission of the government of Kerala for 6 years from 2006 to 12 and then served as a COO at the National Rural Livelihoods Mission of MORD, Ministry of Rural Development, Government of India, until December 2013. And these are two roles which are really instrumental in driving zero poverty programs. And in fact, in her last stints, both as ACS and as the Chief Secretary, she was instrumental in driving the Zero Extreme Poverty campaign in Kerala, which achieved success, which we will deep dive into and learn from her and Dr. Joy through the course of the day. She also held positions such as Joint Secretary in the Ministry of Panchayati Raj, Director General at NIFT, District Collector of Trivandrum, and Director of Scheduled Caste Development, among others. Thank you, Sarada ma'am. I know you're driving a workshop in Odisha, but taking your time to address all of us on today morning. Over to you. Thank you.
Thank you so much, Arun. So I would like to just quickly take you through the journey of tackling poverty in Kerala before going into zero poverty, because zero poverty, the zero poverty intervention of Kerala happens in the context of the work that went before. There is a continuum here, and it's important to remember that when the first ever countrywide poverty assessment was done in 1971, and that was based on 1960-61 data. One of the highest poverty rates in the country at the time was found to be in Kerala. It was over 60%, and the poverty in Kerala was rated as on par with that of Bihar and Odisha. So what changed, and how did that change? Because it's important to know that even at the height of illiteracy, even at this point of time, the winds of change had already been blowing over Kerala. So we are talking of illiteracy, we're talking of deprivation, and we're talking of very extreme exploitation that was part of the social fabric of Kerala. And this itself had spawned social reform movements which sowed the seeds of change. And then post-independence, you had path-breaking initiative of land reforms, the universalization of food security, health and education, universalization of both health and education. And this saw a rapid decline of poverty in the state to below 20% by the turn of the century. And there were also other initiatives. Sometimes you could look at them as questionable, but the unionization of labor and out of that, the creation of welfare fund boards, and which meant that there was a wide net for social security that had been cast. And it was also important. These were important in changing the landscape of poverty, because these also contributed to high wage earnings in the unskilled sector, and also to a society that learned about how collective bargaining could actually widen the space for entitlements. And so Kudumbashree was formed in 1998 and took about 3 to 4 years for Kudumbashree to reach the length and breadth of the state, to exist in every single Gram Panchayat and municipality of the state, and create a community structure, a network of 4 women who became the bulwark of the poverty reduction and eradication effort of the state going forward from that period. So once Kudumbashree had stabilized into a full entity, in 2002, the then government came out with a very ambitious and interesting program, which they called Ashraya. Now, Ashraya, the word Ashraya, it can mean shelter, it can mean help, it can mean the reassurance and support. So it is a combination of all that. And as you know, it's very difficult to translate meanings from one language to another completely. And Ashraya is a program that does, Asha is a word that does carry those very nuanced connotations. And this program, however, looked almost exclusively at destitute rehabilitation. So while Kudumbashree was the poverty eradication mission, within Kudumbashree, a special program under the aegis of the local governments of the day was brought in, which was destitute rehabilitation. And this destitute rehabilitation actually took on the idea of community-based identification of the destitute. So Kudumbashree itself was a program through which the poor could identify themselves. Uh, and those who felt that they were poor could come in, and there were a set of indices which were easy for communities to examine, and out of which poverty could be ascertained as to whether a family was poor or not. Ashray came in with an additional set of indicators, but yet still continued to ask the community of women to look around themselves and to find the destitute in their midst and come out with a program in which, so Kudumbashree did the identification. Kudumbashree then sat with these um, families, destitute families, and worked out an entire 360-degree need assessment. I mean, do they need housing? Do they need infrastructure? Do they need education? Do they need food? Do they need health support? Do they need livelihood support? What could be done? So they worked out a plan of action on this basis. And so there was some funding which came in from the government, but a large proportion of the funds actually came in from the local governments, from the Gram Panchayats and municipalities where the project was running. So this was the Ashya program. Now, Ashya, from 2002 to 2016, it went through multiple iterations. I mean, up to 2021. The last version of it was called the Destitute Free Kerala. And then in 2021, when the then government came back to power, they came up with in their election manifesto. So one of the things that they said that they would do would be to eradicate absolute poverty. So not total poverty per se, but to identify those who were completely out of the system, the people suffering from extreme poverty, um, and look at reducing that. Now, in the meantime, the Niti Aayog had been doing its own assessment of poverty, and it had found that multidimensional poverty in Kerala, and this was, I think, the year 2022 or 23, when it identified that the multidimensional poverty in Kerala was below 1% at that time. Only Kerala was seen to be the state which had, and it still continues to be the state with the lowest level of poverty. So it was 0.77. It has gone down further in their assessment to 0.54 in the latest assessment. But now, so for the state, it was like, can we identify these people who seem to have been outside the gamut of government intervention and support, which in Kerala was actually a very wide net. But to do that, it was important to understand why Ashriya was not able to address this. And so so the learning on Ashriya threw up a few learnings. Now, one was that the indicators that Ashriya used were not adequate in and of themselves. They had to be more nuanced, and they had to capture specific vulnerabilities in the Kerala context, like HIV/AIDS, like the PVTGs, like unskilled migrant labor who actually settled in the state, the LGBTQIA and plus their issues, urban slums, because again we went with the supposition that we did not have slums, but we did, and they were very neatly tucked away, but you did have some like habitations. And their challenges, plus a new layer which comes in of severe climate insecurity. One other thing that we realized was that a combination of Kudumbashree and local governments was not enough. You needed a whole of government approach to address the problem of extreme poverty. It could not be left to the responsibility of a single department. And the third was that Ashraya talked about it, but what never was really able to put together a robust data-driven monitoring system so that the sustainability and completion of interventions that were created could be ensured and tracked. So this was something that went into the strategizing and conceptualizing of the extreme poverty eradication program of the state government. Now, before uh, the first issue, so you could look at it as two things. One was the identification, the proper identification of these extremely poor persons, and the second was working on making sure that the implementation actually was 360-degree and sustained. So for BPL surveys, the history of BPL surveys in the States has not been very encouraging. There has almost always been dissonance over what are the parameters that we've taken, what was the methodology that was adopted, the process, the results. And part of the problem has been imperfect targeting. Part of it has been that the execution itself was piecemeal. Um, and quite a bit of the issue was the fact that there was an absence of strong policy which tackled these challenges head on and brought the idea of welfare and equity into strong focus, because everybody wanted to be poor if poverty, if being stamped as being poor got you a whole host of government subsidies and affirmative action. And that meant that the genuine poor, they're the ones who were influential or had connect with the system, would get in, and the ones who were invisible would stay invisible. So for us, the important challenge was to overcome that barricade. Therefore, the EPP philosophy actually decided to look at a participatory identification of poor. This was something that had been worked out in the NRLM. Um, there had been multiple experiences of doing this, or Tamil Nadu had done this, Odisha had done this. And therefore, the lessons of PIP were also brought into the ideation of how we could do this. Now, when we say Adidaridar, extreme, who are the extreme poor, we call them the Adidaridar in Malayalam. And this was a term that was used to distinguish the destitutes who were outside the systems from those who were in programs like Ashraya and Destitute Rehab and Destitute Free Kerala, who were already under consideration and being supported by the system. Because it was about mopping the ones who had been completely invisible. Now, the timing of this was also important because this comes almost immediately after COVID. And COVID was a time when Asha, Anganwadi, neighborhood groups, ward committees had gotten extremely active. In Kerala, the effort that had been taken to track every family at risk of COVID, to extend support to them, to particularly during the lockdown. It was a time when our extension workers got to know their localities like the back of their hands, got to know people, and people intra-household, to people who are suffering from intra-household poverty. I mean, the household itself might not be poor, but there would be people there who were in extremely difficult situations. They got to see and understand everybody. So that knowledge was fresh in the minds of the system. You had local organizations and associations that came out with great Samaritan work, and that includes hotel associations and cooperatives and multiple residents associations as well. So we found that there was that this was the time was right for a nuanced understanding of people facing deprivation in their local context. And these were the ward members and councillors who had been through this, but also connected with people in all walks of life, with philanthropic organizations who are willing to lend a helping hand. So this made it possible for the state to actually alternatively imagine a participatory identification process that could tap into this collective knowledge that was real and current at the time. So this meant that we could look into actually look at a universal program. And and that was the basis of the strategy of finding the extremely poor. Now, of course, there were risks, and these risks had to be identified and minimized. And this meant that, if our indicators were incomplete or inaccurate, it would lead to eligible people being left out. There could be, the indicator could be great, but there could be misinterpretation by the people on the ground. And that could also be, it could be a deliberate misinterpretation, which would lead to subversion, or it could be a genuine misunderstanding. And you need to be able to be on guard against that. And the perception that subsidies and benefits would be tied to this identification, that there'd be a lot of money coming in, would be put a lot of pressure on the participants to identify people that they wanted to help. So many ineligible households also could be brought in. There would be naturally pressure on the elected representatives by vested interests for inclusion, as well as from the part of the local government, a countervailing disinclination to commit funds, and therefore they might just want to keep the numbers low. There could be a problem of vulnerable areas and population not being adequately covered, or the system not reaching out there. And there could be, of course, dissociation and apathy, which would lead to a lackadaisical enumeration. So these had to be tackled at the outset itself. And so whether the indicators, and there was a very nuanced effort that looked at identifying indicators. We had critical and extremely critical indicators that were drawn up, and we looked at multiple permutation combinations of these indicators to see whether somebody who was actually genuinely poor would come out, or somebody who was not that poor would be able to come in through these indicators. So the indicators, their categorization required ground truthing. We did pilots, we did multiple iterations of FGDs ran FGDs to see whether how people were interpreting things on the ground. And so it was Killa that anchored this program, this identification program for the state, and resource persons, senior field experts who had worked in poverty alleviation and who had worked in Kudumbashree were brought in. They did field checks. They provided very critical and sometimes the feedback was unforgiving too, but it was invaluable in refining the criteria. So yet another thing in undertaking an exercise of this nature was to trust the democratic forces at work. We had to trust that the participants would be representative enough of various socio-political interests that would therefore safeguard against derailing of the process. And this required that the process had to be highly transparent, that the engagement had to also be of a very high level. So the greater the transparency and the greater the engagement, the less the scope for appropriation. What would be required, therefore, would be very clear citizen engagement space, full disclosures, and strong and healthy deliberation. This meant we needed to also look at various databases. So one of the things that we also did was look at databases of the poor that were already there. So we looked at Anganwadi-based data, we looked at health data, we looked at Social Security Mission data, we looked at PWD data. So we pooled in data that was available locally at the panchayat and municipal levels, got the concerned persons to sit through that, identify and name all these people, and through that also identify people who should perhaps have come into this list but seem to be missing. So there was that scoping exercise of data also that was done as a preparatory intervention. And of course, all this ground truthing and identification, the experience of the FGDs went into preparation of very people-friendly manuals that would allow the facilitators on the ground. Um, they were comprehensive, but they were simple, and we and had a major, very massive capacity building and orientation process that ensured full participation and strong and consistent monitoring of this value chain of identification. So when in a uh, nutshell, what was the scale of this event? And this is perhaps one of the largest exercises of participatory identification of the poor that has been ever undertaken. We had 100 strong state level master team. We had 650 district level resource persons, 1,100 resource persons at the local government level, because to broadly coinciding with the number of local governments we had. We had 14,686 trained elected representatives who were also trained and brought into this program. We had 1,840 local government nodal officers who were specifically identified. These were at the block level. We had 14,000 plus local self LSG level committees and 2 lakh ward level committee members. There was a mobile app that had been developed, so 1,000 plus persons handling the mobile app, 50,000 enumeration teams, because all the validation that came out of the FGDs then went through an enumeration, went through a super check exercise, and you had 1,100 strong super check team. But all these families, that came out, there was the enumerators went to the households then, sat with them, made 2 assessments. One was that these were genuinely destitute and extremely poor families, and also to make sure that we had not missed out on anything. And ultimately, about 60,000 FGDs, 57,947. So together, 13.74 lakh people across the breadth and width of Kerala took part in the exercise, and they identified 64,006 families. So that was how this went, that, over 15 lakh people were able to exercise that diligence and come out with 64,000 families. Now, the interesting thing is that, in Kerala, everything is up to debate and it would be torn wide open. But when the process was completed and it came out in the assembly sessions after that, unlike previous years when every survey would be ripped apart, there was complete acceptance across the political spectrum of the identification process. Now, so that's identification. The next concern, obviously, is the implementation of this. So for that, it was about micro plans for each of these families. We needed to map all the deprivations. It was important to give the hope of agency to these poor, of being able to be in a position to determine how their lives were to change, and the reassurance of support for the same. So this sounds simple, but actually generating trust, really listening to the needs of vulnerable persons, not imposing one's own worldview, requires a high level of empathy, which also required training, and where the community network of Kudumbashree and its experience with NRLM and Ashraya actually became invaluable. Now, there was a shift in implementation strategy from Ashraya to EPP, and this was subtle but significant. From the whole of local government, it was moving to a whole of government approach. So, linking with schemes, funding opportunities, with the various support structures that are already in position, with volunteers who would be brought in and who are functioning in the area, and then getting the buy-in of the local governments for all these various interventions that were identified. That was part of the process. And out of this process, you had a three-pronged strategy: immediate, short-term, and long-term, that had to be set in motion. Immediate meant in looking at immediate entitlements that could be given, from job cards to BPL ration cards, health insurance, social security pensions, disability disability identification, certifications, bus concessions, Aadhaar, voter ID, opening bank accounts, etc. All these were to be done. And then once those actions went in, they took off. They also were continuously reviewed at the highest level. What is interesting is that each department and the ministers of each department actually reviewed what they were doing. It was almost as if everyone, the accountability was so very clearly defined. No department could escape accountability. Now, alongside these, you also had some two critical interventions. One was the fact that there could be people who were suffering from extreme hunger and also from very severe health issues. And they needed to also be brought into the immediate interventions. So families in need of food support and in matters of health, the important priority was ensuring medicine supply and for the bedridden or terminally ill patients, palliative care. Now, moving on to short term, these were meant to identify, to cater to needs that were identified during the projectization. So it could be about basic amenities, learning materials and tools for children, case-specific treatment, etc. And this was again tied up with departmental and centrally sponsored schemes. For the long term, you looked at housing and infrastructure, but you also looked at livelihood, skilling support, provisioning of land and housing. In terms of employment, you looked at lighter work opportunities like packing, making mask or paper bags, or operating kirana stores, etc., or supplementary livelihood activities for caregivers, because very often you had people whose quality of life itself had been very severely compromised. So caregivers for the families were identified and provided support, so that all these plans were just ultimately fused with each other, and it was about convergence. Now, the implementation of EPEP, as you can see, was not a run-of-the-mill exercise for the state. All concerned departments had to do a deep dive and take accountability of the outcomes that were to be achieved. And this, because we had a very robust data tracking system, no one could escape, the extent of achievement that they had. And you also, the fact that the elected leadership constantly prioritized helped that the departments down the line did not lose focus. It is a mistaken notion, really, that convergence is easy to come by and that it is only department recalcitrance that stands in the way. But what we have seen is that while comprehensive orders and constant monitoring help convergence, are not enough. They're necessary but not sufficient factors, because you do need enabled communities. You need enabled local governments, and you also need to invest in persistent capacity building for ethical and equitable governance. And this has to go to all stakeholders, both government and non-government. And otherwise, convergence will just be mechanical or disjointed. So at the end of the day, when you look back, there of course will be questions as to how comprehensive this exercise was. What are the new challenges that are likely to arise? And would there not be new destitute who would be coming into the framework, and how would we be tackling them? So, what EPEP showed us was actually that we can build on the foundation of resilient communities and overlay it with purposive governance at all levels. It also showed us that we can make that, or it proved that the statistically insignificant actually do matter, and that it is possible to walk the talk of an equitable and compassionate government. Thank you.
It is now my pleasure to introduce the next panel. Please welcome Dr. Joy Ellerman, a medical doctor by training and a public health specialist. Dr. Ellerman recently served as a member of the Kerala State Disaster Management Authority and previously led the Kerala Institute of Local Administration as its Director General. From the People's Plan campaign to disaster management and local governance reform, Dr. Ellerman had been at the forefront of efforts to strengthen the state's capacity to serve citizens more effectively. Next, we welcome Shri Anant Shankar, who serves as the Joint Secretary in the Planning Department, Government of Andhra Pradesh. He looks after the monitoring of the Swarna Andhra at 2047 vision, Family Benefit Management System, the Zero Poverty P4 initiative, and Zero Poverty Mission. His work was instrumental in shaping proactive, dignified social protection pathways for vulnerable populations while scaling grassroots development innovations in health, education, and rural livelihoods through Niti Aayog's Aspirational Districts and Blocks program. Finally, please welcome Shri Alok Kumar, the Principal Secretary of Planning and Program Implementation at IT and Electronics Department, Government of Uttar Pradesh, who will be joining us online. He is also the Nodal Officer for the Uttar Pradesh $1 trillion economy mission and leads the Zero Poverty Abhiyan, Uttar Pradesh. With over 25 years of experience in public administration, he is recognized for advancing data-driven governance, digital transformation, and inclusive development. Dr. Rahul K. Sharma, Director of Research and Impact at Indus Action, will be moderating the session. Handing over the stage to you, Rahul.
Thanks so much, Shruti Shri, and thank you to everyone for joining us here. This is a continuation of the lecture that we heard from Sarada ma'am, and I think while she laid out the long arc of how you actually build systems to get to eventual anti-poverty programs and the role of community mobilization, there are a lot more details to it. And so what we'll do in this session is actually speak from the perspective of 3 different states. So first we'll start with Dr. Elleman, who was the Director General of the Kerala Institute for Local Administration at the time. And he will get into some of the weeds of the broader narrative that was set up by Sarada ma'am. And so technically I'm supposed to be the moderator, but the panelists have made it quite simple for me because they have very good presentations. So I'm just going to sit here, and if maybe at the point of Q&A, I will jump in. But I think it's better that all of you listen to the experts who are here. And so I will just hand over to Dr. Elleman. And sir, just for the slide changes, please let the team know that.
Good morning, and thank you for this opportunity. See, my life has been made very easy as well as tough by Sarada madam. On the one hand, she has covered what it is, and that makes my life easy, but then it makes my life tough because then I need to see how it's not totally repetition. Of course, it is going to be repetition. So, I mean, I don't go into all those theory and other things, but the only thing is that for me, poverty cannot be defined. It needs to be felt. And that is beyond all our definitions and indicators and all kinds of things. And it's actually about absolute socio-economic deprivation. And we call them absolute poverty, relative poverty, and all kinds of things. But for us, when we try to tackle it, we try to see it as extremely poor, the poor, and also the borderline poor, just like we have it in diabetes and all, where we see borderline, about 2 kind of people also. So we need to consider all these things if we are actually trying to tackle poverty, extreme or whatever you call it, but we need to see that entire scenario kind of thing. So basically my presentation is more about how we did it, not about the conceptual and other kinds of things. But then the whole idea is that Rome was not built in a day. But on the other hand, you also heard Sarada madam talking that in 1960s, we were on top with regard to our poverty. See, 60% of us were poor. And we also had the Kerala, this is not the Kerala which you are talking of now. We had the untouchability, and not only untouchability, we had the system of not even coming face to face. So that was the kind of discrimination we had. And then we transformed it, which means it is possible everywhere. I mean, that's how it is. So we had the reform movements, the farmer and peasant movements, the various social organizations, political and civil society organizations, which Madam said. But then there are also the legislative measures like the anti-tenancy legislation, which means nobody is under the landlord, you are independent kind of thing. That makes a whole lot of difference. It's actually about empowerment. And the land reforms, of course, that then the universal education and a strong public distribution system, which was there, universal public distribution system, which was there, and several welfare schemes. I won't call it social welfare schemes. Now we have to say social justice schemes, I would have to say. And then the massive literacy movement which we had. Literacy which went up to the 96% kind of thing at that point of time. Then the People's Plan campaign in the 1996. That's about participatory local planning. And then the local governments come in. And when we had these 3 Fs transferred, the functions, the functionaries, and the funds were transferred in the 1996, where majority of the anti-poverty schemes and programs were also transferred to the local governments. When I say local governments, it's the panchayats, various tiers of panchayats, the municipalities, corporations, and all. And then it is at the same time that the Kudumbashree comes in. So in 96, we started with the People's Plan campaign, and by 1998, we had the Kudumbashree. It is not a self-help group movement. Please remember, it is actually a neighborhood group movement. It's a federation of neighborhood groups, a lot of difference between the SHGs and the NHGs, and it is actually under a broad umbrella of the local governance system, not local government system, broad umbrella of the local government system where panchayats or the local governments as well as the Kudumbashree exist in a symbiotic relationship that makes a lot of difference. And then Kerala is also known for social action. Whatever I mentioned earlier, it's all about social action kind of thing. The evolution of EPIP, the Extreme Poverty Identification Program, is what Madam mentioned, but we had the anti-poverty sub-plan to be prepared by the local governments as part of the annual plans, as part of the People's Plan campaign. So it didn't have any methodology and other kinds of things. They were all supposed to have under their annual plan, they need to have an anti-poverty sub-plan. We had the women component plan like that, the anti-poverty sub-plan. And then Kudumbashree was actually asked to tell us how the poor can be identified as part of the anti-poverty sub-plan. And the Kudumbashree, as I said, it's a symbiotic relationship with the Kudumbashree and the local governments. And then the 9-point distress factors were identified. That's what Madam mentioned. And if you are in that 7 distress factors, you are in as poor. Okay, that's how it is. So 9 distress factors, but if a family has 7 distress factors, you are considered to be poor kind of thing. And then came the Ashraya program, which is a little more targeted program. There again, it was all about local government and Kudumbashree, but then there were also inherent weaknesses and there were no ownerships at various levels kind of. Finally, it all fell upon the Kudumbashree to manage it, not the government, not the local government. It got just into that kind of thing. But we also had destitute-free program, the hunger-free Kerala, and then finally in 2021 we decided that we need to start a little more in earnestly, and then came the EPIP program or the Extreme Poverty Identification Program, where we first tackled the extreme poverty, which we do not cover them many a time. We have a lot of schemes across the country right from the 1950s onwards, but then there are things which do not cover under any scheme. You have the schemes, but how you really address is going to be the real thing. And then finally, we will go into the micro plans. Next. So my point is, my focus is on this, actually how we tread the path. And that is for you, all of you actually. I understand that you are in Indus Action and your team and all the states are actually into zero poverty and whatever terminology which you mentioned, but finally it is that which. And then the first thing is actually about developing criteria and indicators. That's going to be the crucial thing. How do you do that? Then developing the process and the methodology for identification. That also you need to start thinking. See, it is not about copying whatever we did. That's why I am putting it in this way, so that some of the steps you can take. So the criteria and indicators, you will have to decide based on the situation and also the process and methodology. But we also say this is how we did it. But then we had a large scale training plan. So that's what Madam said. See, around 40, I will come to that also, because the large scale training program is even for People's Plan campaign, I would say the capacity building has been the key on People's Plan campaign kind of thing. And then we had to do the master trainers, the number which Madam already mentioned, the resource persons. And then after all these criteria and indicators, we tried the pilots. We tried to do in municipalities, in panchayats and a few panchayats and other things in various locations, Kerala. And then a lot of things came in, a lot of points came in, and then we had to modify it and other things. And then we went in for the identification across the state. Then what do you mean by a microplan? We had to do and developing a methodology for microplan preparation. These are some of the things which we step by step, you would say. But at the local level, at the final level, committees at various levels, especially I would say, see, of course, there were the committees at the state level, the district level and all, but at the local level, we had panchayat level or the local government level committees and the ward level committees, because we are divided into the wards and ward level committees, because our panchayat is almost around 15,000 to 25,000 population, whereas wards are a little more compact kind of thing. So ward level committees and volunteers. But in the meantime, we also developed a strong MIS, the Management Information System, that actually really strengthened our movement, I would say. And the mobile app, it was all through the mobile app that, so every day evening, Madam could actually do a review, immediately knowing what has happened, what is the number, all kinds of things come. And a large scale campaign. It is not about somebody going and doing and identifying people. It is actually about the entire state, the people understanding that such a thing is going on. You have to be aware about this, because it's basically parts. And actions at that local level, we had various other lists about poor and other things, houseless, all kinds of lists for each scheme. So the first thing they did was compile all those, take all those out. So houseless could be there, some other schemes, Andyodaya list is there, all kinds of lists are there. Try to pull all of them. So it was not a survey. I mean, we have to understand that it is not a door-to-door survey as we usually do for BPL identification. But initially all these lists were collected and then did the thing. And also participatory listing of the poor through FGDs. We had around 57,000 FGDs conducted with various kinds of people at each level, local level. And they identified that, okay, that house could be of extreme poor kind of thing, and people know each other kind of thing, where the Kudumbashri, especially the Kudumbashri, because it's a neighborhood group, they know which house is your neighbor, how they are and other things. Identification of those who are left out. Because in all these schemes, I mean, all these lists, you find this many lists and this many people, but then you miss the real people. You can go and check in your own states and places, and then you will find how they are not there. You had a very good list prepared in right earnest, but then you miss people. So the neighbors can tell us, say, why they are not there and why they are there. That's also good. See, one of our idea was also this one. See, there are also people who are ineligible people already in the list, eating whatever has been kept for the extremely poor or whatever. So that was also, so when neighbors come together in FGDs, then they understand that, see, how did they, because otherwise you don't know. I mean, I don't know whether you are in that list. But once it was open and started discussing, then they said, no, they cannot, because their son is in the Middle East, but you are still in the list. Whereas certain other cases, they're absolutely poor, but they are not in any of the list without even the ration card and the Aadhaar. Those kinds of people are there in every state, every place, in Kerala also. And then there was the enumeration. That is based on this list. So they don't go into the entire households, entire population, but based on the list prepared, consolidated list, they go, 3-member team, there is an officer, but there are also the Anganwadi worker or the Kudumbashree worker, and that's kind of the people who go and then enumerate and see whether whatever has been mentioned in this one is correct or not. That's how it is. Then the data entry, the consolidation, the draft list is published, and it is submitted in the Gram Sabha again. And there is also a super check. That's an higher level, block level people coming and doing a super check for 20% of the identified list. Because you don't have to go and just to see whether they have followed the right kind of methodology and processes. And then it is a final approval by the panchayat or the local government. And then starts the micro plans and the resource mobilization and implementation of the micro plan. I'm just trying to be a little more deeper into this, where criteria, indicators, and process and methodology, which I mentioned, it had to be objective and transparent. No one to be left out is the key, and also ineligible to be excluded. That was also meant, because otherwise what usually happens is that there is something going to come, which means I want to be in. The political parties and others also want to get people in, not out. So if poverty, just like people are waiting for to be included in the poverty list, but we made it clear that no scheme is going to come. So you are not going to get anything. It is going to be identification only, and it will be for the panchayats or the local governments to take care of them, and no additional scheme coming in, so that it is not going to be a dole scheme going to be given. So that is how it is, and we will be only addressing the right kind of thing. And we developed developed the process and methodology, Kudumbashree, but consultations with the various groups, like the experts, the elected representatives, civil society, and officers, and all kinds of things, how this methodology and criteria could be developed. So after this, there was this consensus on, we will go by four things, four factors. Basic uniform criteria applicable to all is about food security, housing, or housing or shelter, you can call it, the health, and income or livelihoods for survival. These are the four major things. And under that, various sub-criteria would come. But it was also decided that local variations to be considered. Because if it is a so sacrosanct kind of criteria, then that is where people miss people. So we need to say, for example, in a coastal area or a tribal area, your criteria might not be totally applicable. See, I can tell you, we have some of these institutions where you have health institutions, for example, where you have this criteria for putting it in the bracket of free versus subsidized and other kinds of things, where if you come to Trivandrum, the capital city, and coming from a hilly area or somewhere, where they come and say, I have 2 acres of land, and then in the person who is sitting in the office would in the hospital office would consider them as the richest person, because in city 5 cents of land is kind of thing. So this is the kind of difference which happens. So this is where, and the sub-criteria, so there are also sub-criteria under each criteria, special criteria for tribals, fishers, urban, and flexibility in criteria for avoiding exclusion. So everyone knows that this is an extremely poor, but they would have had a fan there or a scooter in front of that house, or all kinds of such. Somebody would have donated a coat or something like that, and then you get excluded with all your criteria. Whereas we know that they are poor. So this is how it is. So uniform extreme distress factors, the distress factors, and the special factors. If at least 1 in red means you are in, you are an extremely poor. If at least 2 in orange means you are again there. If at least 1 in orange and 2 in the other factors, then you are in kind of thing. So the local activities I said, identifying the excluded, the FGDs, discussion in Kudumbashree platforms because they are the neighbors kind of thing. World level committee to prepare the draft list and all those things which I mentioned. Role of the local government was also decided. They did all kinds of things which I mentioned here. So, and this is the kind of training programs which we had to conduct for all these kinds of people. We had the cascading kind of training with state level, district level, and kinds of things. So this is the chain of trainings which happen for each fact. See, everybody is not given the same training. Depending upon what is their role, trainings had to be done. So that was actually literally a tough time for this thing. And then around 4 lakh people trained, as Madam said, 57,000 people, and 64,006 were identified as extremely poor with all this categorization. But so some of the broad district factors like the income-based health. Basically, I'm not worried about the number. How this serves us is actually when you start preparing your micro plan, you know that these have been the problems they faced, and that is how they became extremely poor. So that way, your micro plan becomes easier because you know that these were their issues, and within no time, sometimes they get out of this thing. So this immediate service plans, the short-term plans and long-term plans, each household is considered separate. So it is not a general scheme kind of thing where, for example, I know that a particular house, they get their pension, but they cannot go and collect the pension, they get it at home. That makes a lot of difference. But they have the money with them, but they cannot cook. Both of them are bedridden. That is where they are extremely poor. This is the kind of health. Or I can also tell, see, there is a family with the differently abled children. Both the children are differently abled, or disabled, or whatever you call it. And the mother, the widow, is there. And then she can do work, but how can she? She cannot go for employment. And this is how the poverty comes in. So basically it is about, next is our resource mobilization. I can tell you once this list was published and all these participatory activities, everyone came to know that this is extremely poor, this is there. And then suddenly their relatives come in. So they also feel that, oh, our relatives like in such a situation. Many of them, within 3 months, There are also various organizations which come and help. There are also for shelter and all, many people provided it. So it is not just about the government. So there are a lot of people who come and support, and sometimes it is just about the employment and other things. And so now it is actually towards poverty-free Kerala. Extremely poor to poverty-free Kerala. But then we'll also have to see whether these people go back. And it's actually towards sustainable development goals. So your poverty goal 1, number 2, 1 or 2 or many others finally converge to poverty. So it is actually poverty-free Kerala. Thank you.
Indus Action Group for us this opportunity, and it was really good to hear Madam Chief Secretary, like ex-Chief Secretary, who shared her experiences about how did they reach to zero poverty position in Kerala. As you all know that UP is a big state, and we are having a population of more than 24 crores people, and so any problem or any issue which is there in UP, it has so wide, I would say, to tackle those problems, because we also, apart from this thing, the nature of the the population is also very diverse. We have very different, when you see Eastern UP and Western UP, the kind of when we look at the per capita income also, the Western UP is comparable to any other richest state of India, and the Eastern UP part is it's extremely poor. And our per capita income, the per capita income of UP is around 50%. Now we have slowly moved from 50 to 53% of the per capita income of we are at 53% of national per capita income. But when it comes to the regional variation, there is a huge regional variation. So now when we started this Zero Poverty program, this was all thanks to our Honorable Prime Minister and our Honorable Chief Minister. They exhorted us to embark on this journey and to make sure that we try and we strive towards zero poverty Uttar Pradesh, zero poverty state. Next page. We have when we started this exercise, we decided that we have to first identify 25 poorest family in each Gram Panchayat, and we have, as you can see on the screen, we have around 58,000 Gram Panchayats in our state. We have 75 districts. So we identified 12.36 lakh ultra poor households to first target them and to make sure that they are pulled out of poverty. Again, the enumeration exercise was done over a period of 3 to 4 months, and we have put in a place a very structured mechanism to track this program. We have a governing body which is headed by Chief Secretary. We have a steering committee which is headed by myself, and we have a program support unit. Next page. This journey started in August 2024 when we finalized that we have to work towards Zero Poverty program. The framework was institutionalized, the governance structure was put in place. The official launch was done in October 24 when we decided on that what would be the target population. We decided that we have to identify 10 to 25 poorest household in each villages. Initially, the number was 13.5 lakh. And out of that 13.5 lakh, the verification, the entire thing, of course, there was a questionnaire where we did all kind of verification related to their living condition, what is their so after this validation, we finalized on this 12.36 lakh households. And we already had a family ID database. Family ID database is like a golden database kind of thing, where we have details of each and every household, and we were covering a population of about 70% of the households who are getting covered under family ID. So, and when we are pulling information, say for every all state government schemes or central government, most of the central government schemes benefit those who are giving some kind of direct benefit transfer, be it in cash or in kind, they were integrated at one place, so that for every household we can pull most of the data, most of the beneficiary oriented data from this master database, and we can identify that what all benefits this family is not getting. So say for example, if some family or some household has been provided PM Awas Yojana, benefits under PM Awas Yojana, or any member of that household is getting old age pension, then all these data can be pulled from family ID database, and that helped us in getting further verification in the field. So these 12.36 lakh households were further they were mapped from family ID database, and we could exactly go in the field and we could identify that what all digital inputs we are getting from other departments, whether this is correct, yes or not. Next. So after all those things, we have a dedicated dashboard. We have details of all families, whatever the survey was done, all the details are there, their photographs, their condition of their houses, everything is there. So then we is our this thing up to reach up to zero poverty, we are following a phase-wise approach. So in phase 1, we identified all those basic minimum requirements which should be provided to any household. So that was phase 1, say, or if a person is eligible for old age pension, or if that household is eligible for PM Awas Yojana or Ayushman Bharat, all those things are getting covered under phase 1. And phase 2, which we have started in October 25. So phase 2 is related to multidimensional poverty. So making sure that they have access to clean fuel, they have access to other amenities, say electricity. So all those things are under phase 2. So we have already given the benefits of 88 lakh DBT benefits have been provided to these zero poverty households. We have 4.2 lakh families, they have received some or other, they have all those eligible scheme which was there in phase 1, it has been provided to them. And 9 out of 16 DBT schemes, they have achieved more than 80%. Can we go and show the slides where we have the details of phase 1? So yes, so this is the phase 1 schemes, ration card like NFSA, PM or CM Jan Arogya Yojana, disability pension, widow pension, old age pension, BOCW, as you all know, this is building as other construction workers. So we are making sure that all those who are eligible for to be registered under BOCW. They are part of BOCW. So through that scheme, they can get multiple benefits for their families. They are also part of, if they are having easy land, they are part of PM Kisan Samman Nidhi, and they are like of course they have they have to be provided the PM Awas Yojana. So they are like, as you can see, that the eligible for most of the schemes we have reached about 80%. But only for PMCM Awas Yojana, we have about 5,91,000 eligible family who are yet to be provided housing facility. And for that, we have already entered data of about 5.53 lakh have been entered on the Awas Soft, and we are hoping that we will get the funds allotment from PM or if possible from CM Awas Yojana for these zero poverty people. Next. Then this based on multidimensional poverty, as I was talking about, PM Ujjwala Yojana, household toilets, making sure that they have safe drinking water facility. They have like all the women who are eligible, they are enrolled under our NRLM mission. And this is also very important, the school enrollment, because there are multiple families, and we have done the vulnerability mapping also. There are multiple families, thousands and thousands of families, where there is only one grandlady or grandfather, and there is children who are less than 14 years of age. So for them, we have made sure that at least all these kids are enrolled in a school. And for this, we have achieved around 100%. We have made sure that all these, because not only at this point of time, we have to make sure that even if they are pulled out of poverty, it has to be sustained. So, and the other thing is, we have a Bal Seva Yojana where we are providing multiple benefits to a orphan who has lost either of his parents. Then we have a, for women welfare scheme, we have a Mukhyamantri Kanya Sumangla Yojana where we are providing benefits to a household having a girl child, and it is at 6 different stages. First, it starts with the birth of the girl child, then her immunization, and then class 1, class 6. So there are multiple benefits which the household can get from Mukhyamantri Kanya Sumangla Yojana. So we are targeting that at least zero poverty households, if they are eligible for any benefits, then they are getting those benefits. And the last one is electricity. Next. So this is what we have done. I was talking about vulnerability mapping. So we have identified the most vulnerable family, those having a single disabled women citizen, and it is a single household family. So what should we do for this family, 117 family? What should we do for a single woman senior citizen, 10,901 families who are having just single woman in that household? So these are various vulnerability we have identified, and we are focusing on that what scheme we should launch for those who are in A category, what should we launch for those who are in B category. Say for example, I was talking about the 2-member household, both members having disability, or having a child who is less than 18 years of age. So the task is not that simple. And I'm so happy to learn that, and we have to involve our local bodies also in the entire process, because, and we have made a provision of 250 crores rupees for in our state budget. But whether we should give again, we should top up the pension which say a old lady is getting, and if she is disabled and is more than 50 years or senior citizen, then whether we should top up something more. The pension which we are giving 1,000 rupees pension, that may not be sufficient. So what are the other options? So that we are deliberating upon, and very soon we will. So these are the most vulnerable family, because the next set of family is where we have one or more youth who is there in that family. Can I go to that slide? So for those households, which is again out of that 12 lakh, it is more than 11 lakh households who are having one or more youth in their family. So for that we have to we have various courses, various programs which are going on there. So we have to make sure that those youth get benefited out of this program. So as you can see on your screen, we have done a verification of 10,28,000 youths, and these youths were identified through our family ID database. And for like out of these 1,28,000 have been found eligible for skilling courses, and they are getting enrolled under skilling courses. All, I guess, already more than 45,000 have already been enrolled in this. 45,000 were previously skilled. So out of those who have been previously skilled, we are making sure that through a UP Skill Development Mission or ITI, we have, like every state has ITI. So we are making sure that we have to target this 45,676 youths, and we are making sure that they are provided job opportunity. We have some like 40,000 youths who are enrolled already in high schools or higher secondary schools. So we are tracking them, and through various career counseling programs, we will make sure that when they complete their 12th education, that they can choose between ITI, and so like then the career counseling becomes very important at that stage. And as you can see in this table, we have multiple schemes which is run by government. One is CM Yuva Udyami Yojana, where we are giving 5 lakh collateral-free and interest-free loan to our youths. So in that schemes, 1,208 youths of Zero Poverty program, they are getting benefited there. Similarly, there are multiple schemes. We are trying to make sure that out of this like 12,36,000 who are identified in Zero Poverty program, they are given the priority in all schemes which are being run by the state government. So if they are eligible, it is not just limited to pension or household toilets or other things, but any livelihood program, if they are eligible, if any youth is eligible, then we are making sure that we are reaching out to them, and the application and everything we are hand-holding and making sure that they are part of these programs. Next. And we have also signed MOU with our CSO partners, CSO and CSR partners. We are hoping that through that engagement, we will be able to again reach out to all those who need skilling, what kind of skilling requirement they need. Like we want to map each and every household, as Kerala has done. We want to map that to what is the skill requirement for that particular family, and we through district administration involving all our like ground level officials, we want to make sure that they curated like this thing is provided to skilling opportunity is provided to this Zero Poverty family. And for this we have engaged with various CSR partners. And not only that, the other focus is the first and foremost focus is of course skilling, and the second focus is healthcare. So we have engaged multiple partners who are who will make sure the health services provided to the family, we are able to provide those things. Next. And one more thing which we have done is that we are tying up with various universities, because we have in every blocks we have about 28 blocks, and in every blocks we have multiple degree colleges. We have around 80 universities in our state. So we want to make sure that if we can partner with the universities, if some of these boys who are studying there, if they can go, if they can help us in identifying the right solutions for this Zero Poverty people, then of course we can fast track this entire exercise. So we do feel that it has to be a very, as Kerala has done, it has to be a very democratic exercise, and we have to involve it. It need not be just limited to government efforts. We have to involve local bodies. We will have to involve our youths, other stakeholders of the society. So this is what we are doing. We are I guess this is the last slide. We are completely focused on enterprise development support, making sure that if a lady is eligible under NRLM or SRLM, then she is provided the opportunity to pull herself out of the Zero Poverty program by engaging herself in SRLM. And skilling and job placement support, this I have already, and not only through skilling, we are talking to banks, and I guess more than 1,000 jobs have also been provided by our banking partners. And health, as I have told you, we are focused on health. If a ASHA is going there in a village, then the list of Zero Poverty people has to be there with the ASHA, so that if any pregnancy comes in a Zero Poverty people, the Asha and Anganwadi, they have to make sure that all kind of maternity services are provided to that family. So I would say that, I guess this is the last slide. So I would say that this is like we have a dashboard where we can pinpoint, we can go to the district level units, we can go to the village level unit, we can look at the details of each and every family. So I would say that our journey has just started. It's like we know that in last estimates of multidimensional poverty, which was done by NITI, we are at like 17 point some percentage of population which should be in our which should be multidimensionally poor. And I'm hoping that based on NFHS 6 data which has been released, we should be again somewhere about 10 to 11% must be like multidimensionally poor. So we have to move very fast. And but again, as I narrated that the situation, like we are such a diverse population, and the inequality is also very high. So we have, but we will make sure that all government programs we provide opportunity, we provide benefits of all those government programs to these households. And our focus is through involving our civil society partners, we want to make sure that at least like this will be, again, as I was telling you, that this will be a phased program. First, we want to make sure that these 12,36,000 families are pulled out of poverty or extreme poverty, and then we will move to the second cohort. So gradually, I hope that in next 5 to 6 years, we should be able to at least claim that now no family is under extreme poverty. So thank you so much. Thank you.
A very good morning to all of you. I mean, it has been a wonderful session this morning, learning from the models which my previous speakers presented. Kerala model is one thing which we also have been studying in Andhra Pradesh, and we have lots of learnings from them. So those also we are incorporating. So I'll take you, I mean, since being the last speaker of this panel discussion, I have a limited time, so I'll just take you through the slides. I have a brief slides, and I'll take you through a journey which we have started almost 1.5 years back. Though convergence of schemes, deliveries of benefits to the vulnerable societies, that has been happening in Andhra Pradesh. Andhra Pradesh is one of the top states when it comes to providing direct benefits to the vulnerable communities over the long period of time. But then the Zero Poverty Mission is something which we have started almost a year back, and we have undertaken different activities when it comes to that. It's not one single mission, but there are multiple layers associated here. So I'd just like to take you through that. So basically, when it comes to Zero Poverty Mission, there are 3 important pillars to this. One is the abject poverty elimination, where we are trying to eliminate the abject poverty. Then there is the private P4, public-private people partnership, which basically looks into the aspirations of the poor communities in the state, poor households in the state. And both of these sit on the platform of family benefit management system, where basically we are trying to work on providing a database, a secure database, which has a very high saturation and quality of the different attributes when it comes to different households in the state. Next slide. Family benefit management system. As I was talking, so we have around 1.7 crore households in the state. We have certain attributes pertaining to these households in the state, but then what we saw almost 1 year back was that these attributes are not properly saturated. There were missing links, and then the quality is one thing which was again found to be not very truthful. So we started working, Zero Poverty Mission started with this family benefit management system, and we started working on improving the saturation of these parameters, so attributes. So basically there are 26 attributes pertaining to each household which we identified. And we started working on those attributes. We started working with different departments. So different departments have their databases which were in isolation. They were working in silos basically. So we started working with them, the data started talking, then we got in touch with the central government, we tried to get some information, EPFO, Vahan, income tax details. So started merging, and we started creating a golden source of truth for this. So that was the main objective, and through that we started identifying the eligible beneficiaries who were left out of the different schemes, as well as the ineligible beneficiaries who were availing different schemes. So this is the way we started. We also tried to, we are in the process of identifying, of basically estimating a family score for the different families. So families, we are trying to bracket them into different groups, baskets, and then accordingly trying to give a score to them, which will be again be a dynamic score. And then a visibility. A family card is another thing which we are in the process of making, where we can provide a visibility of the different schemes which a particular family is being provided. Cradle to grave. This is another thing which we are working, providing automatic delivery of services to the household. So I guess there was a video which was being played at the start of this session. It was quite interesting that people have to go to the office. They are not, most of the times they are not aware what all schemes they are eligible for, and they get left out also. So what we identified is if these households, if these are mapped properly in the state, then we can have an auto trigger at the major events pertaining to each of these schemes, which can be automatic, where the persons involved or the concerned who are their beneficiaries, they can automatically get enrolled in those schemes. So less of governance, that way, invisible governance which we are talking about, then proactive delivery of these services that we can do. So as you can see, the events starts from the birth to the death, and then there are certain events at the different intervals of the life. So be it the birthday, or I mean, this is something which we see, like pregnancy is one thing, then the retirement, or child attaining 15 years of age. So different intervals we have identified, and accordingly now what we are doing is we are trying to provide an automatic auto-enrollment to these services for the different citizens of the state. Next. Family score I was talking about, so we are trying to estimate this. We are working with two different institutions, IIT Kanpur and ISB Hyderabad, and we are trying to, basically right now the POC pilot is going on to estimate this score. So we are trying to group the families into 5 different buckets, and accordingly once this is done, then we'll see what kind of tailor-made welfare schemes which we can provide to these families, and this will definitely be a dynamic score. So how the families will move from one bucket to another, that is another thing which we'll be taking forward. Coming to the abject poverty elimination. So this is from FBMS, we have now moved to the family, through the abject poverty elimination. And here, yeah, I guess we can go to the next slide. So here the identification of beneficiaries is something which we are working on as of now. Out of these 1.7 crore households, we have taken cues from the Kerala model. Identification of families is something which we have found that is the most critical aspect of undertaking any poverty elimination program. So we are trying to study the model. We are not rushing. We are trying to study the different models in the state, in the different states across the country, as well as some other models outside the country also, like Cambodia is one model which we are studying right now. So based on this, we are already doing, we have identified 2-3 models, and we are doing pilots at present. We are, in next 2-3 months, we'll try to finalize that, and based on that, we'll be identifying the poorest households. So roughly around, as per the different models which we have tested as of now, what we are finding is around 3.5 lakh households in the state. Roughly around 2.5% of the entire households in the state are coming into this particular bracket of the families which are presently living in abject poverty. And this will be undertaking most probably through the Society for Elimination of Rural Poverty, which controls the SHG network in the state. So all those things are in the process, and hopefully by this year end, we'll be starting the grounding of the schemes, the convergence of schemes, and the implementation part for these families. So yeah, as I was talking about the methodology of identifying the poorest households, so the abject poverty who are there, so we have identified certain criteria. There are certain exclusion criteria. We have taken cues from the multidimensional poverty index from the Government of India, and then we have tweaked it as per our requirements, the state requirements, and then accordingly we have identified this is one of the model which I am showing you the figures. So 10.2 lakh families across the state we have found, and out of this 10.4 lakh are in rural households. P4, public-private people's partnership. So this is a pet project of Honorable Chief Minister Shri Nara Chandrababu Naidu Garu. And this is something which he wants to involve the society also to empower the families. Next slide, please. So here basically the mission statement I would say for this is the top 10% to handhold the bottom 20%. So top 10% is flexible, bottom 20% is something which we have defined, which we have identified, and then we have created an online portal where the government acts as a facilitator, where the top 10%, whoever wants to contribute, adopt a family, there are 3 models of adoption here, I'll come to that. So whoever wants to contribute to that, they can come and they can adopt those families or their needs or even a community as such. And the government basically acts as a facilitator here. We play the passive role here. So the person who is inclined in adopting is called a Margdarshi, and the person whom the bottom 20% households which are identified, roughly around 20 lakh households in the state, these are called the Bangaru Kutumbam. So we have mapped them territorially, we have mapped them the community-wise also. So we have given plethora of options in our portal, online portal for this P4, where the Margdarshi can come, and Margdarshi can be anybody. It can be a corporate, a public sector unit, or an individual, or for that matter, a person outside the country. And the different models of financing also we have given. So it's not only financial model, but non-financial models also, skilling, mentorship, guiding any person. Even emotional connect is one thing which we are focusing on this. Quite a unique initiative. And we don't have any precedent for this, but we are working on this. Trying to learn from the different models which are there across, not the exact model, but yeah, something which is similar to this. So yeah, there are 3 different models here: the adopt a family, adopt a community, fund a need. So, and all these things, these 3 models are available for the prospective Margdarshis to come on the portal and adopt the families or the model or the need or a community. Next slide. So this is status as of now. We have around 11 lakh families being adopted by around 1.8 lakh Margdarshis. Till now, 4.7 lakh households have been impacted, as I told, financially, non-financially, emotionally, skills, mentorship of different sort. And then when it comes to community development, there are 113 mandals which have been covered and 1,400 plus villages which have been benefited out of these. So it's a coalescence of what I would say is the CSR initiatives as well as any voluntary initiative which a person can take or an institution can take. Next, I guess that's it. Yeah, so that's it. Since I didn't have much time, so I have kept it limited to 5-10 slides. Thank you so much. Thank you.